So just to give you a little bit of history about this credential, the CNS, this was started through the Board of Clinical or through certification for nutrition specialists and established in 1993. And this certification program was started by doctors. And that's one of the reasons why I got my CNS is it was offered through my University of Bridgeport nutrition program. And we wanted to, basically, we are physician nutritionists. And for me, what happened in my practice is I wanted to be able to offer clinical nutrition to my patients who, as I was getting older, they were getting older, and I saw them gravitate more towards allopathic medicine, more towards drug therapies, and I wanted to be able to use a holistic approach to providing interventions for my clients and my patients. And this aligned really nicely with my my doctorate degree. And then as we moved along into the 2000s, 2010, 15, a lot of master's degree students in nutrition also qualified to become nutrition specialists. And so now this arm, the Board of Certification for Nutrition Specialists, is under the umbrella of the American Nutrition Association. They kind of all came together about 5 years ago, 4 or 5 years ago. And I think it's a really good thing because the American Nutrition Association really supports their CNSs for jobs, also for legislation, to go out and get licensure, to challenge boards, because what's happened in the playing field out there in nutrition healthcare is RDs have they've taken over, like they're the only ones, but there's a lot of education programs that also qualify, and this is one of them that does that. And I'll talk about how our program, our master's degree program, basically meets that requirement for the CNS. And basically, this is the most advanced certification for personalized nutrition practitioners is the CNS. And so this is basically, they set the robust standards and competencies for you to practice clinical nutrition. And what I like about their mission is that it aligns with my mission. And I'll talk a little bit about that in a minute. And so I'm going to take you through a little bit more information about the ANA and introduce you a little bit more about the certification program and the requirements, the 3 eligibilities to be able to get the certification, and then how part of it is doing a supervised practice experience and then taking the robust examination to make sure that you meet the skills and proficiencies of this certification. So here is, just to let you know before I get too involved in this, is that all of this information will be put on the MSCN program Moodle page. And so these slides will be there. So you'll be able to click on all of these links that I've inserted in here along with this recording of this webinar. So when you click on this, you're going to go to their main website and you're going to see their first page will be this page. And what I like about their mission is that they really are championing science and based or evidence-based nutrition practice, which is clinical nutrition. And they want to move, like I do, move nutrition into primary healthcare. We want to be able to integrate, because we're finding that 7 of our 10 top chronic diseases are nutrition related. And that's a problem, and it continues to get worse. And we really want to be able to target through nutrition care and help individuals to not be so reliant or dependent on medications, and to help them live a healthier, longer life. And so that's what I like about the American Nutrition Association, is they align with my personal mission also. So for the CNS, basically it is evidence-based, and they have core competencies that you have to meet. So it's very rigorous. There are a accredited program through the ACNPE, and basically if you do get this certification, you're going to be demonstrating not only to your own colleagues, but to maybe future employers and other individuals such as family members and the public that you hold the highest standard, that you really truly are the expert in personalized nutrition. We found that previously a lot of dietetics practice, especially through the Registered Dietitians Program, they've are trying to come full circle with us, practicing more in a holistic manner. So that's what we also believe in, is practicing, or our philosophy is providing or delivering nutrition interventions that's not just in a box or one size fits all, right? And so that's why we're really emphasizing the word personalized for advanced professional nutrition practice, is we're really taking the time to assess and to evaluate each individual based on their genetics, based on what they eat, their lifestyle, social determinants of health, what's their financial or social status, what's their culture. Those are all personalized nutrition practice. The other important thing that you should know is that the CNS is also accredited by the National Commission of Certifying Agencies, and it's the same agency that accredits the RDN program for this nutrition practice. So we are on that same level. And so to let you know that if you do obtain the CNS, that you will be vying for similar jobs that RDs are vying for. You will also try to challenge also state boards licensing for dietitians. So we're really encouraging CNSs to do that. So to be eligible for this CNS, you must have graduated from a master's degree program in a university that's accredited, which we are, or you have to have your doctoral degree in the field of nutrition or healthcare related field. You also need to achieve the education requirements, which we do here at our university, and I'll show you a layout of how our curriculum does that. And then also you'll need to get a passing score with the CNS examination when you sit for that. And then you also need to obtain 1,000 hours of supervised practice experience, which part of that can be done within our clinical program, our clinical nutrition rotation, and then our virtual clinic, and then the capstones, which I'll talk about in a few minutes. So the BCNS, which I was on the board, actually, I actually helped write the CNS examination. I've also been on the board of the American Clinical Board of Nutrition, evaluating their education for continuing education in nutrition. So really, you are to demonstrate through the examination and through your clinical practice and supervised practice that you meet the highest criteria and those competencies and standards for achieving to be the expert in nutrition. So the 1,000 hours that are required to the supervised practice experience for those who took my nutritional assessment class or those who are going to take the nutritional assessment class, it's going to be divided, the competencies for this CNS credential, into 4 different categories. We call it the nutrition care process, which is a term coined by the RD profession, but also we've coined it as our personalized nutrition care model. And it's the same pretty much. But those 4 categories now in the CNS are actually 3 categories, and they are: you need to demonstrate nutritional assessment. This is your subjective and objective competencies. Interpretation, which includes how to do a nutrition diagnosis and your PES statements, how to develop your intervention, and do monitoring and evaluation. And so these are the categories in those 1,000 hours that you have to achieve to meet the competencies for this credential. The beauty of this CNS is now you are are creating an avenue for yourself to be able to practice or obtain licensure to practice nutrition in many states. And the beauty of this American Nutrition Association is they have an advocacy division. Unfortunately, that person left, but Amy Smith, who I'll show you as the main contact, is taking over that advocacy. And we are able to practice personalized nutrition and counseling in 43 of our states in the US. And also 19 of those states will offer or allow CNSs to be eligible for certification or licensure. And so this is a really important and a reason why you want to pursue this CNS is it will give you more job opportunities in healthcare, academia, industry, and government. I have several of my students who are now teachers at universities, teaching nutrition at community colleges. Some have gone back and actually are getting their doctor in clinical nutrition. Some are working for public health departments, working in government, and or working for industry, doing maybe job or corporate nutrition and corporate healthcare. So there's a lot of opportunities. And you can see this link down here. What I did is I teach foundations of community nutrition, and there was a really nice handout in the text about different nutrition jobs that are available to you out there. So if you click on this, when you get a hold of the slides, you'll see all the different professions. Many of them are RDs already, but like I said, doesn't mean that you don't qualify for these types of jobs also. And you have to be able to know that you'll be applying for jobs that might request or ask for an RD, but you will be challenging that because you do meet a lot of the skills and proficiencies already. And so you'll be on the front lines performing medical nutrition therapy and or clinical nutrition to help battle these chronic diseases that I talked about. And so this is going to help you when you get out there in the job field. This next slide is just a summary of what I have already explained, but I wanted to just give you this quick check information. And there are 3 eligibility requirements. First is the education piece. Second is getting your supervised practice experience hours. And then the third is sitting down and taking the CNS examination. And so all of you will probably, like myself, want to refer to this first column here that I'm outlining with my cursor. And this talks about the decree that you need, the coursework, your experience, and the examination. And then at the end, once you get your CNS, you'll have to keep up with your continuing education credits, which is about 15 credits a year, but you only have to prove it every 5 years they check. So, but if you also are a registered dietitian and you are getting your CNS, then make sure you refer to the second category. Or in my program at University of Bridgeport, there were other medical doctors, whether they were dentists, DOs, or MDs. And so if anybody fits that category, you'd be over here. If you're an ND or a DC, a PA, physician assistant, you would also refer to this first column. Okay, so for the curriculum overview, the BCNS, if you click on this, it'll take you right to their website and show you all of the course requirements. And it's 35 semester credit hours of relevant coursework that will be required to meet the competencies for the CNS. And then on this next page, this is what are courses that qualify for the CNS. This is a PDF. And if you click on this, you can see we have outlined all the different courses that will qualify. You'll notice on here that we had to convert our quarterly hours are going to be less and count for less because they want semester hours. So really our quarterly hours are only 1.33 of the semester hours. So that's why we have quite a few courses that you'll have to take to be able to qualify. So let me talk about the types of experience that you could obtain in your supervised practice experience. As I stated earlier, it's in these four different categories, but really nutritional assessment and interpretation have become one category. They combined it. So they just have an A, B, and C category. And you can earn your hours by what we call observational or indirect hours. And you can obtain up to 250 of those hours. And I would probably guess that you get close to those observational hours just in your second year of this program. So you could probably meet that. And then the direct hours are 750 to 1,000 hours because the observational hours are actually optional. So I don't want to confuse you, but that's just kind of how they set it up. And the independent direct hours are actually working with clients and or working under another provider or supervisor, seeing their clients and doing nutrition care. So that's what we call direct. And then the types of supervision that can happen can be direct or in person and or remote. So those are the different types. And in the Q&A, we'll talk a little bit more about what that means. So here's a little bit more information about the supervised practice program. This is a video that Amy Smith, who is the director of the certifications, she put together. So if you want to know a little bit more, you can refer to that. And then here are the competencies that I was talking about that are set up in those categories that I outlined earlier. And then a lot of these supervised practice experiences can be done or achieved through internships, through your capstone, through the clinic rotation. Also in the virtual clinic, you can obtain up to 72 hours per term as part of your master's degree curriculum. So let's talk about how these hours are divided out for each category. So for category A, which is nutrition assessment and interpretation or diagnosis, you need a minimum of 200 hours. And then in category B, you need another 200 hours. This is the intervention piece that has to do with education, counseling, and ongoing care. And then in the last category, it's monitoring and evaluation. This is where you're assessing the person for roadblocks. Also, if you have actually achieved the intervention, but they have another problem, then you are going to reevaluate them, or if you need to update their diagnosis. So this is on usually follow-up visits that you're going to be getting these other or this last 200 hours. And so you can see that's only 600 hours. And the rest of the remaining hours can be obtained from any of the above categories. But you need at least 200 in each of those. Okay, so you can also, when you find a mentor, if you're not in Oregon and you find a mentor, it's really encouraged that you have your mentor who you want to supervise you if you're in another state to become a approved supervisor, and they have to fill out an application with the American Nutrition Association. And they have to at least have 3 years of clinical experience to be able to supervise you or to qualify as your supervisor. So that's what we are encouraging. And that way they can directly supervise you or maybe remotely supervise you. Also, your supervision hours can be completed before you take the exam, but they don't have to be completed before you take the CNS exam. So if you feel like right after you graduate, you want to take that exam because you feel like everything's fresh in your head, then you can do that. I did that because I was in healthcare already, and I've already met a lot of competencies just being in practice for 23 years. So it was, like a no-brainer just to jump in and just get it done. But for you, you might wait. And in fact, historically, they have seen those who are close to getting their hours or almost have all of their hours actually do better on the exam than those who just jump right out of school. Go out and get that experience is basically what they have seen as people who've been more successful on the exam. This is just a summary of the hours, the categories, and basically just the different activities under each of those categories of things that you can be doing or that you uh, basically will be achieving to meet the competencies for each of those categories A through C. And then this is our postgraduate nutrition internship program that I put together for that. And basically, you can be working with clients in several situations. And even in the capstone, you might be able to be working maybe with your mentors, clients, or patients. And you might be working with clients or patients in a group setting or even in a community-based internship program. And you can see that in the middle is the categories A, B, and C. And here are examples of observational opportunities, and below are information or an outline of those direct opportunities. Pretty much the direct opportunities have to do with directly working with a client or a patient. And when you counsel individuals and or groups, they pretty much have to be clients or patients of the clinic or of the organization. You can't just go out and do a huge YouTube video for, let's say, 1,000 people and count that as direct supervision because they are potentially not your clients, right? You're just basically marketing to them and you're giving them nutrition information. So that's the difference. As a candidate, you are required to turn in at least one personalized nutrition case data collection report, and this is a link to that report. Usually your supervisor needs to at least see one of those reports, or you're going to be using chart notes, or in the clinic, you'll be using Epic, which is an electronic health record system. And then in my virtual clinic, you'll continue to use the interactive health records and the personalized nutrition templates. So those count or are equal to this case data collection report. And all of these reports and documents are on the MSCN program Moodle page. I've also will show you some links for alternative ways to get to those different documents. And then these reports also have to have occurred within the last 5 years to be able to qualify. You do not submit these forms, though, to the BCNS. The only form that you'll submit, I'll show you when we get done, those different forms. So here's the forms overview page, and they're also in my portal on ANA that you can sign up for. But if you find that your mentor, you would like them to become an approved supervisor, then there's an application form. And then also you'll need to have also the CNS candidate tracking tool. You will track all of your hours based on every single client that comes in that you see, and it's pretty detailed. And there's some videos that are on the MSCN program webpage that will show you how to fill out those forms or that tracking tool, which is on an Excel spreadsheet. And then when you do finish or complete all of your hours, then as a supervisor, we'll be filling out a supervisor's report based on, did you meet the competencies? How did you fulfill those competencies? What are your strengths, weaknesses, etc.? So the different supervised practice experience programs are listed here on this slide. We have developed our postgraduate clinical internship program. So if you are in the state of Oregon or in the metropolitan area, you can do some of your hours for the CNS here. And then there's some information slides and also how to register for that program. Also, if you are in a different state, the ANA also has a practitioner finder. So they'll try to help you find a supervisor, which can be difficult. And then if you find a supervisor, then again, you should have them fill out an application with the ANA. Also, I've given some other external programs that I've had other students take. This is called the Nutrition Collaborative. This is with Alana Bodner. I worked with her on the SPE accreditation. We worked together, and she's a great person. She's also a mentor for the advocacy. She works with a lot of states doing legislative processes to be able to get CNSs either licensed or certified. And then the Nutrition and Health or Herbal Collaborative is with Rebecca Snow. And her programs are very affordable. She also all of these programs also can help prepare you for the CNS exam. I know that Alana told me she has a 100% pass rate. There's been several students who've also done the Nutrition and Herbal Collaborative, which I think has been more financially feasible. And then the Clinicians Incubator is with Meg Bowen, and she does a lot of the CNS webinars. And I also worked with her on the SPE accreditation program that they're trying to put together. So these are some just external programs that you might find beneficial to help you prepare and get your CNS hours at the same time. So lastly, how do you apply for the CNS exam? Twice a year, they hold the CNS exam in June and December. So basically, it's 200 multiple choice questions. And I have to let you know that it's very applied questions, meaning they're going to give you case questions about, so-and-so comes into your practice, they come in with these signs and symptoms and their lab tests revealed this. What do you think they have? Or so-and-so was diagnosed with such and such. What would be the best protocol for this client or this patient? So just to basically give you a little inside information on that, make sure that you are you want to be able to study in that same mode that you're going to be tested on, is my advice. And the virtual clinic really tries to prepare you for that, doing a lot of different cases and working with standardized patients. And the clinic also will help you with that too, along with the medical nutrition therapy class. Also, there are different testing centers across the US, so you don't have to basically fly to Illinois. Whenever I did my master's degree program, I actually had to fly back to Connecticut to take my proficiency exam there. So that's one good thing that the pandemic helped with. So to be able to apply, here is the portal that you'll have to sign up for, and the instructions are here on this left side. Also, you'll click on the BCNS forms. This is basically a complete list of all the forms and applications that I talked about. And then you'll need to sign up for my portal, and there's a tutorial also of how to do that. And then once you log into your portal, you'll navigate the forms page, and then you'll upload the exam application, and then you'll need to pay an application fee of $100. And then if you do get approval, then you'll need to pay a $400 fee to take the exam. And this just went up in July. It was $300. And also the re-exam fee used to be $100 and it went up to $200. So they also have an exam content outline for you of different exam resources, which is very useful to help you study. And then I try to connect other CNSs who have passed the exam with students who are getting ready, so they can kind of get an inside scoop of what was the test like, what resources did you use, etc. So that's kind of it kind of helps each other. So contacts for the ANA are listed here. Amy Smith is the Director of Certification Programs. She's so helpful. Don't hesitate to contact her if you have a question about what does your state do. I just had a student from Wyoming had some questions about her state requirements, and so I looped her in on that email. And so that way you can talk directly to her about what's happening in the state. In fact, I just received an email from Amy about Michigan. Michigan is trying to block CNSs. Right now, they allow CNSs to become licensed, and they're now just put a House bill in to try to block CNSs from getting the licensure in dietitian. Some boards or dietitians boards will have either a single pathway for licensure, or they'll have a dual pathway, either licensed dietitian or a licensed nutritionist. So also you'll see that a dual pathway sometimes kind of segregates you a little bit. Even if you're not a registered dietitian, you could still become a licensed nutritionist. So some states offer that. And then again, Alana Bodner is the state mentorship volunteer advisor. And Ida Sadecki, they both graduated from Maryland University of Integrative Health. And Ida Sadecki also has a guide to how to become licensed in Oregon. And so what I did is I did this. You can click on it, and you actually have to first become a certified nutritionist in the state of Washington, and then you'll get reciprocity, and then you can apply for licensure in Oregon as a dietitian. And it took me, I think, from May to the end of August to become licensed in Oregon. So you have to get your fingerprints, you will have a FBI will evaluate you, and basically it took me about 5 or 6 months, or actually 3 to 4 months to get that to go through. Okay, so let me take some questions. You can also read some FAQs through here. I don't want to read them to you, but it does have some answers. But I first want to kind of check in with you and see if there's any questions. So I'm going to get out of this and try to get back to you all. Give me a moment here. We will stop sharing. Let's get over here. Okay, I see that in the chat there was a few questions. Ellery, second-year student. The program is mostly set up to meet criteria, but you must refer to the sheet to ensure your elective choices meet the remaining criteria. Okay. Ellery, is our nutrition schedule set up for the CNS? Okay, I'm not sure. Jamie, can you elaborate on your question here?
I was responding to Ellery's question. She asked about the electives, and so I was just giving her my feedback as a second-year student, just to try to help fill in those gaps.
Okay, great. Thank you. Ellery, did you get your question answered with that information? Okay. And then Tammy, is it common to have to pay to obtain hours? Yes, it is. And that is one of the questions you'll find. The external programs that I showed you for the incubators program, I think it's $375 a month, and they require a minimum of 8 months. And that's because they're responsible for training you and making sure that you meet those requirements. And there's also another program, that's about $7,000, and it's a functional medicine program. And she does a 6-month program. So it can go anywhere from $375 a month to up to $7,000 to pay for a supervised practice experience program. Now, with our program here, you'll pay credit fees. So each term, it's, again, 2 credits after you graduate. So you'll have to pay, I think it's, what, $485 a credit per term. So it's about $1,001 or $1,010 each term that you take it. You can take our internship up to two terms, and that's in the summer term and in the fall term. And you'll be working with our registered dietitian, Dulcie Childs, in the clinic. Any other questions?
So this is Raylia. I have a quick question. If you're practicing as a nutrition coach, would you be able to use those hours if you find someone to supervise?
Absolutely. Yep.
Okay.
Yes.
And is that usually because you're kind of doing it yourself or you're already a coach? Is that usually where you could probably ask someone and just be like, hey, like, will you be my mentor on paper? Or how does that usually work, I guess?
Well, in private practice, basically you need to find a mentor. You're working with another practitioner a lot of times, or you can have a remote supervisor. So it needs to be somebody who has been in clinical practice for at least 3 years and meets the CNS requirements.
Okay, sounds good. Thank you.
Yeah, and they can do remote supervision for you, meaning like I have several CNS that I have supervised in the state of Oregon. We're no longer supervising outside of Oregon. It's because we don't have licensure outside of Oregon, so it becomes a legal quagmire. Also, we don't have malpractice insurance outside of the state. So we used to provide remote supervision for all of our candidates, but we can no longer do that. So the American Nutrition Association basically told us that can't happen, because it's like, then who does the patient belong to? Because a lot of then candidates were working with other practitioners, and we have to be careful giving advice, especially if that practitioner, who does the patient belong to? Us as the supervisor or to the mentor? And so that became also another legal issue, and why we don't do that anymore. So that's why you have to go out, whether you're in the capstone and you're working out in your internship, that you need to get that person out there to actually supervise you directly.
So Dr. Queen, can we follow up on that just a little bit? Because Addie asked a question in the chat about her supervisor needing to be licensed in the state that she's in. Is that true? Is that the recommendation?
True. Yes. That's true. It should be, yeah. Your supervisor should be licensed in the state that you are in, and they should have malpractice insurance. And then you also should have malpractice insurance once you graduate.
What do you do in the case if your state does not take CNS?
You challenge the board. You challenge the board, and you show that you meet the requirements. And then I would actually have you connect with Amy Smith to help you figure out how to do that. If they don't, then that means you can only you can't practice MNT. you can practice clinical nutrition or do nutritional counseling as long as there is no licensure requirement in your state.
Well, the other thing, Ethel had actually asked a question in the group chat about where it was. I'm at the ana.org/advocate where I see the map of the US. My state actually used to be a different color. Right now it's green. But I don't know.
Check in with Amy because hasn't been updated recently, and she has the most recent updates and information for you.
Okay, thank you.
Yeah. Let me take you to the Q&A for some other questions that have come up. Let me come back to my. Anyway, any other questions in the meantime that I didn't get to while I get back to my.
Hey, Dr. Queen, this is Jamie again. I know you have a couple more questions in the bottom of the chat, but on that same topic, I was just curious. I know it is common for CNSs to get licensed in multiple states, especially when they're practicing, virtually. And since this topic has come up with students who are looking to have SPE supervisors who are out of state, and you've made that clear that is not an option, but what does it take for an SPE supervisor or just a CNS in general to be licensed in an additional state? How extensive is that process? Is it pretty simple? Is it just another test, or is a form?
No,
what does that take?
Yeah, you can probably, once you take the CNS test, it depends on the other state's requirements, and it can cost you. Now, the ANA is advocating we're just working on this. In fact, there was a big questionnaire that came out by the ANA because the RD, the Ascend accreditation program, they are trying to get reciprocity in all states, meaning that way we can work across state lines. And that was for RDs only. And so we got on the tail end of that. And so we also want to be included in that. But, legislation, unfortunately, takes a long time for it to go through. So we may not see that go through for another 2 to 5 years. But that is one of the things that we're trying to work on, to get reciprocity and not have licensure in every single state, because that becomes impossible financially to be able to do that. Does that answer your question, Jamie?
Yes, it absolutely does. And I just wanted to remind you, you do have a few more questions in the bottom of the chat.
Okay. Supervisor must be licensed in the state, which location. Okay, and that was Addie, yeah. Yeah, so you do really need to have your person licensed in your state in which you live. And we kind of already talked about that. Can you earn SPE hours in a place of employment? And I know, Addie, you work in the hospital as an RN. Yes, you can. And under the links and the competency links, you can find that information of what would qualify. Is our nutrition schedule to set up for CNS, or do we need to add more biochem classes, electives? You do need to take the biochemistry class, nutrition biochem, and on that sheet that I showed you for the curriculum for our master's degree program, it'll show you everything on there. You need to take advanced biochem and clinical biochemistry and nutrition course. Or if you came in with a biochem class, that can also qualify you. And you may only need to take one of those in addition to the nutritional biochem. And then also you'll need anatomy and physiology. So some students have had to go back and pick that up later. I think that's the one that most students have had to go and pick up, the anatomy and physiology class.
Hey, Dr. Queen, when we're on the subject from an admission standpoint, looking at that biochemistry class, and I know that we do have a few undergraduates in here too, would you recommend it for students for the prerequisites for the program, would you recommend if they don't have a chemistry class, take a general chemistry class and then do the biochemistry in the program, or take biochemistry as a prerequisite?
What I recommend is taking biochemistry in the program, because my biochemistry class sets you up for the CNS.
Sure.
I put a lot of clinical pearls in there, and a lot of the CNS questions will be included in my course content.
Gotcha. Thank you.
So yeah, you're welcome.
Dr. Quinn, I just wanted to add on to what you noted. This is Jamie again. That in addition to that course requirement list for the CNS, that there is now the nutritional genetics elective that's been added that meets the qualification that would be similar to taking the advanced biochem or the clinical biochem courses.
Yes. Well, the one thing though is I've inserted a lot of the genetics into, especially when there's been enzyme defects, and so, or genetic defects through biochemical means. I've inserted those in those classes, plus the clinical biochemistry and nutrition course is the old functional medicine course, and it also has a lot of genetic pieces to it. So, but also your instructor who is teaching that genetics class, he was a student of mine, and I was his supervisor for the CNS. So I'm sure he's also inserted a lot of the genetics information that also will help you. And if it qualifies and you prefer to take genetics, then I think that also it can be a good thing too.
So I have a quick question about the biochemistry again. So the next classes after this semester, they can, like, the advanced isn't a prerequisite for the clinical, and it's not a prerequisite for the nutritional genetics class, right? Like, we can take any of those in any order then?
You can, but I highly recommend that you take them in order. Take advanced biochem next, and then take the clinical. But some have waited and have taken the advanced in the second year, and some have skipped and taken the clinical in spring and skipped the winter advanced, and then taken it in the second year, and they also have done just fine. So it depends on your workload, your personal life, and what you got going on, and what you feel that you can basically handle, if your plate's full. So.
But just curious, why do you recommend doing the advanced before the clinical biochem? What is the reason? Like, what do you think?
What it is the advanced biochem is biochemistry of diseases. And so that's going to help you with your medical nutrition class. And then the clinical biochem is laboratory tests. So you're not going to understand some of those laboratory tests until you actually have the advanced biochem course. So that's one of the reasons, is it just creates a better sequence of understanding.
Do you think from an admissions standpoint, it would be better to have AMP going into the master's program versus taking it while you're in the master's program?
I personally have advocated for that. I think it just gets you on a higher level, and I think it gives you more confidence as a student, and it helps you, especially with nutritional assessment, when we're talking about different body parts and about different physiological conditions. So I really think that it can be a benefit. Okay, let me just kind of go through here. Can we obtain hours under an RD? Yes, you can. As long as they qualify for the application under the BCNS guidelines. And it is common to pay to obtain those hours. I think I already covered that.
So I'm sorry, can I chime in here about the RD question? So
yes.
Do they have to apply to be a CNS supervisor even though they're an RD then?
Yes.
Okay. And did you say they have to pay for that as well, or no?
No, they don't. They don't have to pay for that.
Yeah. Okay.
Okay, how does it work, students commuting from Washington? So Tammy, expand on that for me. You mean the internship program?
Sorry, that's Nicole, not me.
Oh, I'm sorry, Nicole.
Yeah, that was me. I was just wondering because like if we decide to do our internship through NUNM, those are going to be Oregon campuses, correct? So if
That's
I live in
correct.
Washington, then I wouldn't technically get supervised hours through them.
Correct. Yeah, you could, or unless if you wanted to drive, because the clinic happens on Friday afternoons from 1 to 5 o'clock. So it would just be 1 day a week if you felt that you wanted to drive to our campus, our Lair Hill campus, to do that.
Okay. So it's probably better if I found something in Washington to get my hours.
Yes.
Okay.
Yeah, I would think so. Okay. Some of you I know have to jump off and have another class. So thank you for being here. I really appreciate it. But I wanted to maybe just go over a few more questions that I had and pull those up for you all. Let me get back to that. Let me share my screen with you again. And let's I'm going to scroll really fast, so sorry if I make you dizzy. Okay, your capstone clinical rotation virtual clinic counts up to about 72 hours per term. You'll need to record that on your CNS candidate SPE tracking tool, which is in the MSCN program, and it's a spreadsheet on that Moodle page. And then I already talked about the 1,000 hours. Does time meeting with my supervisor count towards your 1,000 hours? It does. So make sure that you count your time that you meet with your supervisor. And there's a space on the spreadsheet for that. CNS exam pass rate. In June, pass rate was 87.5%. In December of 2022, it was 92.5%. And then can my remote supervisor be from a different state from where I practice? And this, I think, answers one of those questions that was in the chat. Not unless your supervisor is licensed in that state or has liability insurance in that state. And if the state does not have a licensing requirement. Also note that your supervisor is assuming liability for the work that you are doing by, even if you're doing your own private practice, they assume that liability. And they have to authorize and verify the work you're doing, whether if it's direct or indirect supervision, and how you're documenting your work and meeting those competencies. So remote supervision, supervisors usually will hold regular scheduled sessions, maybe once or twice a month, and they can be held in person or they can be done remotely through virtual or by telephone. And the supervisor will basically determine how frequent that they can meet with you and or based on what your needs are. And then as you get more comfortable in your practice or whoever you're working with, or if you're working for them, then the meeting times or the length might be more intermittent and reduced as you progress through the practice experience. And then do the MNT and life cycle course count towards your 1,000 hours? No, they don't. And that's because the courses already are included in the overall curriculum requirement for the CNS. So there's no double dipping on that. And this is, what if I can't find a supervisor in your state? Then really contact the ANA, or you can do independent external supervision program, and I put the amounts that they might charge. So everybody charges a fee for this. And then you at least have to have one of those personalized case data collection forms that need to be completed and evaluated by your supervisor. And then here are our supervisors, myself, Dulcie, and Dr. Erlandson. And if you're an ND doing a dual degree and you want your CNS, then Dr. Baltasar or Dr. Galani, and all of your clinic hours actually will count up to 1,000 hours. So you can fulfill that once you graduate. And then I have the CNS information will be in several different locations on the Moodle page for our program, and then on the American Nutrition Association. I also have it on our Teams nutrition program Teams page. And then this was an example a student had last time. They were doing a IBD presentation for irritable bowel disease, and they were not their patients. And so does the preparation of the presentation itself count for CNS hours? And can I count the time for each person that attends? So if you're presenting to a targeted group of people that could become clients, then that can count towards directed hours. But you cannot count for the time that you spend with each person that attends, only count for the time prep and for the presentation time. So those were some prior questions that I wanted to share with you. On that note, does anybody else have any last questions? Let me get out of this and get back to you all before we sign off.
I had a question.
Yes.
Hi. So for somebody who's going to California that doesn't require any licensure to be a practicing like clinical nutritionist, what does the CNS like do? Is it just essentially to say like you have the CNS title? Does California even recognize it as a licensure, even though they don't require licensing? It's kind of confusing.
Yeah, you again can challenge the dietetics board or dietitians board to become licensed. In fact, one of my students, I was their supervisor. She's in California, Mariposa County, and she actually is getting her CNS, and she's joined the hospital board. She lives in a very small town. People know her, and number one, it gives you status as an expert. It helps you develop your clinical nutrition skills and your proficiency. And she is going to challenge the dietitians board in her state, because that's the same rules here in Oregon also. We don't have a licensing requirement here, but we can get our certification in Washington, and then we can do reciprocity here in Oregon, get licensed. And so if you challenge the board, then you can do then medical nutrition therapy. You can also bill for your services. So there's that potential that you could make more money by billing your services, your nutrition services. And plus the CNS, what you do is you put it on your resume, everything that you are qualified to do, and then you can also, it's going to give you a foothold and for future employers to see that actually you're just as qualified or even more qualified than an RD for different jobs or positions.
Okay, thank you. That makes a lot of sense.
Yeah.
I'm sorry, so that kind of confused me. If Oregon doesn't have licensure for CNS, how do the clinical hours in Oregon count?
What do you mean clinical hours?
When we do our clinical hours, how does that count towards our CNS hours if Oregon doesn't even recognize a CNS?
Well, they will recognize it through reciprocity. So your hours do count towards the CNS. Once you get your CNS, then you have to go to Oregon, get your certification through them. And then they recognize that, yes, you're a CNS, you fulfilled your 1,000 hours by getting your certification through Washington. Yeah, it's convoluted. Sorry. It's hard to explain. There's a lot of different loops and hoops that we have to jump through.
Dr. Queen, I had a question about like how soon this should get on our radar. Like, as like a first year master's student, is this something I need to be looking for now, a mentor? And then how soon do I need to start my SPE so that it kind of lines up nicely and I'm not like rushing or anything like that?
Yeah, that's a really good question, Krisha. Wait till your second year to, you won't be able to get SPE hours until then, until you start your capstone and you do your internships. So you don't just jump right out, and you can look for somebody and say, hey, in your area that who you think would be an ideal person that you'd want to connect with, who would give you some experience, and to say, hey, next year I have an internship program that I need to be doing, but I have to do it here in this state. And would you be my mentor for that? And they may say, yeah, I'll do that. So now is a good time to network with people in your community who could help you become to get your CNS hours, so they can become a supervisor. Plus, they can apply early because it might take 3 to 4 months for them to get qualified through the ANA. So, I would say after your first year, you need to start really, in springtime or in summer, start really networking with somebody in your community. Kira, do you think that's a good idea?
Thank you.
Yes, I would agree with that. It's really in the summer, as you're thinking about where you're headed into what your pathway will be for your career, you'll want to begin making those connections in anticipation of an internship that you'll be developing in the fall.
Yeah. And then for your first year students, you really need to fulfill those biochem requirements and get that core, even though they're not considered core, but they're core for the CNS, get those under your belt as best you can. But I know it depends on, where you're at. I know I worked full time when I was doing my master's degree, and you have to kind of shuffle things and prioritize. You have to determine what's it worth to you and what sacrifices that you're willing to make. The last question I have here, well, Jacqueline, you had questions about, do we know why some states do not recognize licensure or CNS, or as mentioned, attempt to block? And that's because the RDs have been at it longer than we have. They know how to work the system. They have overpowered the legislation, and they have a lot more money. So it's political. So that's part of the reason why that is set up that way. And then last, from Brenda Ballard, are there any undergrad requirements we should be worrying about, or do we just focus on graduate credits to go towards the CNS? I would say that anatomy and physiology, try to get that, which I think you already have in your program, is set up, right, Nicole? Yeah. And then you'll be taking a biochemistry class with me also. You'll be taking the biochemistry and life sciences class in the summer. And so that'll also count towards the CNS. So just to let you know that you will get some of those fulfilled as you move forward.
Okay, so it will be the biochemistry class that is already in our schedule mandatorily?
Yes.
Okay.
Yeah.
Okay, I just wanted to check with that because I came into the program with almost to a bachelor's in biology. So I have the organic chemistries and I have the anatomy and physiology, but I wanted to make sure I didn't need to add any specific electives.
Yeah. Yeah, those for you right now, I think you're going to be good to go. Okay. And then if you have any questions or anything comes up along the road, please, any of you, reach out to me. I'm basically the representative for the CNS. I am the clinical nutrition curriculum director. So feel free. I'm here to help you answer any questions. Things have changed through the ANA, so sometimes things change. And I apologize if it feels confusing at times, but I'll try to keep up with the most recent information so I can pass it along to you as quickly as possible so everybody stays up to date on the latest and greatest. And again, we're really working to get you as advanced nutrition, personalized nutritionists into primary health care as best we can. So we're working on so many levels. And what I did also, since I got my LD in Oregon, my licensed dietitian, is I applied to sit on the board. So I thought, well, maybe I can, have some influence that way. I haven't heard back yet, so we'll see what happens. Yay.
And I'm sorry, I do have one quick last question.
Yes.
I noticed that fundamentals of nutrition is counted in 2 different categories. How is that, like it's counted under biochemistry and under nutrition specific courses? How does
I
that
think it's just part of the credits count. The ANA gave us just a few credits from the from the fundamentals. So I think that it could go towards either or both. I can't remember. Dr. Erlinson, I'll have to ask him about that.
Okay, I was just kind of confused how the one class could fit into 2 different categories.
Yeah, they give us a few credits here and there for that under different topics or under different requirements. Yeah, we're trying to keep it squared away.
For the biochem on the curriculum, I did notice that there's only 1 in the first year. So just to clarify about that question again, we will have to go out of our way to add another one down the line in first year.
Yeah, Molly, are you in the master's degree program?
Yeah, I'm online now.
Okay, online, yeah. So you will need to fulfill the advanced and the clinical, and those are counted, they're under the electives piece.
Okay.
Yeah, so you'll need to add those this year, or if you can.
But if we have past biochem credits, those could count too, correct?
Yes, that's correct. And I would recommend that you contact Amy Smith. She'll be able to let you know if they count or not. And she'll let you know also how many credits that they count for, because it depends on if it was a semester class or a quarter class also. Does that make sense?
Yes, thank you.
All right, you're welcome. I think that's all we have for today. Is there any other last minute questions that I can answer before we end for the day? Thank you all for being here. I really appreciated your questions and your participation. And again, I'm available. Reach out. We're always working to help towards your success. And we really believe that the CNS certification is worthwhile to pursue it, especially if you want to practice at a more advanced level clinical nutrition and be eligible for other types of jobs out there, opportunities. All right. Thank you, everybody. Have a great afternoon or the rest of your evening.
Thank you.
Thank you. Bye-bye.